Thank you for joining me today for what I wish I knew before I signed up for Medicare. So let's get started. So let's talk about what we wish we knew before signing up for Medicare. Because knowing this information can help prevent penalties and get you signed up in a timely fashion. So, first of all, before we get going, let's talk about work requirements. One of the things I wish I had known was what are the work requirements and what I'd have to do. Well, in this situation, you do have to work 10 years or 40 quarters to get your Medicare Part A premium zero at a $0 premium, as long as you have 10 years or 40 quarters or you've paid taxes. Because having zero for Part A can save you anywhere from $251 a month to $521 a month. Let's talk about what we wish we knew about Medicare versus employer coverage. Your current employer coverage probably has a deductible, a copay, a percentage that you have to pay, and then a max out of pocket. So we're used to that kind of plan, but the structure for Medicare is completely different. Most plans do not have they might have a max out of pocket, but they don't have a deductible. And if they do have a deductible, it's minimal. $257 deductible all the way up to $420 deductible instead of having, gosh, $5,000, $6,000, $7,000 deductible. Also, provider networks. When you're through your employer, you know the plan that you have, you understand what your network is and what doctors are in it. Once you go to Medicare, you have PPO plans where you can go to pretty much any doctor you want to, HMO plans where you have to stay in the network, and then there's just plain old Medicare that has their own network. So it's very important to understand the network or to talk to somebody about your doctors when it comes to the type of plans you're looking at. And then there's the eligibility rules. How many years or quarters do I have to work, which we discussed a few minutes ago, 10 years or 40 quarters? And are there any other eligibility rules out there I need to be aware of? I wish I had known or understand the enrollment window when it comes to Medicare. Now let's take a look at that. If you are turning 65, you have the 3 months before you turn 65, the month of your birthday, and the 3 months after to sign up so you don't have any penalties. If you're going to continue to work, which is another thing that I wish they had discussed, if you're going to continue to work and take coverage through your employer, then you needed to understand that all you need is your Medicare Part A. You don't need your Part B yet. You only need to pick up your Part B when you're retiring at age 65 or if you're over age 65 and retiring. I wish they had really discussed penalties and how that's going to affect us when we're turning 65, because this can affect you for the rest of your life, and it can be all kinds of issues, and it can affect your Part B and your drug plan. So let's take a look at that. Now, you have to understand the penalties. If you miss your initial enrollment period, which we just looked at a few minutes ago, well, there's going to be a penalty, and we're going to talk about calculations. This is going to increase your monthly premium rate through Social Security. And unless you are Sooner Care or Medicaid, this is going to be permanent. It's a lifetime penalty you pay monthly. So let's look at Part B. What happens in Part B? Let's say you're turning 65 or you're over age 65 and you're retiring. You have to be retiring and not taking active coverage, and you don't take your Part B. Well, first things first, if you wait past your initial enrollment period, the only time you can apply for your Part B is January, February, and March. And let's say it's a year to 2 years later. Well, now you get charged 10% of your Part B premium each month for life. So let's say the penalty premium is $185 and you have a 10% penalty, so you're paying $18.50 on top of that every single month for the rest of your life. I also wish I had understood Part D penalties. Um, Again, it's if you don't take it when you're retiring at age 65 or when you're retiring over age 65. And when I say retire, I mean you're no longer taking coverage through your employer. If you go several months without this coverage, well, it's 1% penalty per month. So let's say again in the other example, you went a whole year. Well, now you have a 12% penalty that you have to pay on the monthly premium additionally every single month for life. So understanding when to pick up your Part B and your Part D is very important. I wish I had known when we could change our Medicare plans. Now, on supplements, you can pretty much change any time as long as you can pass medical underwriting. And in some states, such as Oklahoma, we do have the birthday rule. So every year from a person's birthday for the following 60 days, we can go shopping for a different Medicare supplement at lower costs. On the Medicare Advantage, you can change every year, October 15th through December the 7th, and it becomes effective January 1. If you're not happy with that, then you can make another one-time change, January 1 through March 31st. And there are also several special enrollment periods, such as moving in and out of a zip code for Medicare Advantage. Say you moved out of the country and then you came back. There are 32 special enrollment periods if you're making some kind of change. I wish I'd understood the two different types of plans better when I turned 65, the Medicare Supplement and the Medicare Advantage. Now, if you don't understand how those plans work, I just did a video on the two different types of Medicare plans, and you're probably going to want to go out and look at that video. There are so many other rules and factors that you really need to know about or consider before making a choice on the type of plan you want. And again, getting advice for somebody who has their insurance license is very important. Yes, your friends can tell you all kinds of benefits, but your health may be very different than theirs, and your situation may be different than theirs. So your best bet is to talk to a licensed insurance agent so that they can review all the factors, check doctors, drugs, pharmacies, tell you what kind of plans you're eligible for so that you make the choice of which plan is best for you. Now, if you have questions, I'm happy to help. You can contact us here at Senior Benefits Consulting. Our number is 405-246-0305. Again, that's 405-246-0305. Or if you wish to set up a quick 30-minute discussion, you can go to www.sbcmedicare.com and choose a date and time that works best for you. Thanks for joining us today.